want to say a special welcome to Dr. Roger Hunter, known as a neurologist, but he's a social commentator as well. Um, Doctor, you have recently made some statements that caused the eyebrows of many to raise, as it seems not to be going with the one size fit all trend that seems to be the order of the day as it relates to COVID. What substantially is your point as it relates to the pandemic?
Well, first of all, thank you for hosting me here. I think it's important that I just point out that I'm a surgical neurologist, or otherwise called a neurosurgeon or a neurological surgeon. So it's important distinction. But I still have a great interest and understanding of the brain and the spinal cord and the nerves, and that interest is relevant because the brain, spinal cord, and nerves are often repositories or reservoirs for viruses in the body. So any surgical neurologist should be always aware that the structure that they're operating on literally potentially has viruses embedded within it. And so, for instance, that knowledge would allow you to interpret situations that could happen prior to surgery or after the surgery. So if the patient is not waking up, it could be that the virus that was dormant there is reactivated and actually depressing the patient's recovery. But with that said, I think as a Caribbean medical student in Jamaica, the Caribbean and particularly Jamaica is teeming with viruses. And anybody who is trained at a local medical school, the dominant one, would be aware that there are lots of viruses throughout Jamaica. Herpes viruses, particularly HTLV1 viruses. And we have Epstein-Barr virus. We have the regular winter viruses, which are not endemic in Jamaica or unique to Jamaica, but they're brought here because of transnational travel. Dengue virus is endemic since the 70s in Jamaica because we have the perfect environment for the vector, the mosquito, the Aedes aegypti mosquito. So having an understanding of viruses is something that most locally trained doctors should be comfortable with, very, very comfortable, because Jamaica is in fact a powerhouse for virology in the world because of how many interesting viruses exist in Jamaica. And I suspect that's also true when it comes on to the plant world. And a lot of farmers in Jamaica can teach you a thing or two about viruses in Jamaica and attempts to try and control plant viruses. A lot of zoologists also would be able to relate to you about animal viruses. And at this time, I'd probably want to recognize Professor Louis Grant, who was a foundation or the founding father of the virology microbiology department at University of the West Indies. He, though trained at University of Edinburgh, he was instrumental in eradicating the Eastern equine encephalitis virus in the 60s and the 50s and literally saved our local horse racing industry. He was also instrumental in the control programs for dengue and also was attributed to eradicating yaws from Jamaica. So you have to be very comfortable with viruses as a medical student in Jamaica. You have to be very comfortable and as doctors. Now, I know as years go by, we specialize, and so you may forget some of the foundation principles and some of the fundamental principles. But as I said, as a surgical neurologist, I cannot forget it because my area of work is constantly impacted by viruses and scan interpretations and assessment of patients. We have to be always aware that this could have been affected by something so tiny that we cannot see with an MRI scan or a CT scan. What very much can be detected in the blood by doing appropriate blood tests or sampling within the fluid around the brain and the spinal cord. Now, particularly what really, uh, caught my attention about coronaviruses in last year, in 2019, was more of a humanitarian one. Why a government would be seeking to suppress the consciousness of a public regarding the outbreak of a particular virus. And that we're speaking about China. Why would the Chinese government be, at least initially, appear to be suppressing the outbreak, which colleagues or colleagues in China were trying to bring to the world's attention, that there was in fact an outbreak. And perhaps there are questions bigger than me, but that really caught my attention. What also subsequently caught my attention, why the WHO was not able to declare this more quickly, why their monitoring systems failed. And we now know that is itself the focus of an internal investigation within the WHO, why they took so long to alert the world to this crisis. Now, we in Jamaica, we have been strongly associated with the Chinese community, and there's increasing commerce between Jamaica and China, not through America, but directly, both by air and also by sea. And it is well conceivable that we would have been in contact with people directly from China who had this virus from as early as September last year or October last year. But it was not necessarily detected. And there are anecdotal evidence that, for instance, there was a huge visiting team from China last year doing eye surgeries, and there were concerns around people who got ill. And in fact, there were Chinese and Jamaicans that got ill, and there was a question surrounding that. What, in fact, could that have been related to the outbreak that was happening in China? But Jamaica never really suffered a public health crisis in terms of having the number of deaths that we saw happening in Wuhan, China. And this continued to play out in social media and mainstream media. And the Chinese government really had to be backpedaling when they finally came to their consciousness and recognized the issue. We saw the chairman of China, or the president of China, visiting the area and really acknowledging that, in fact, this is a crisis. And so we saw severe lockdown measures being implemented to try to contain the virus in China. We in Jamaica were observers like the rest of the world. But as this virus began to spread outside of China, it became clear that it would have been a great concern to us, because countries nearer to our borders were being severely affected. For instance, when we look at Italy, we were really concerned about the severe death toll that was happening in Italy. And then subsequently Paris, London in particular. I mean, there's so many flights per day, so many flights per week from Jamaica to London. And so it's very conceivable that this virus, which then spread, and it's a respiratory virus, spread through the air, particularly to Europe, causing death and disability, and would then subsequently affect us in Jamaica. Again, by the time we are aware of a virus heading in our direction, we can comfortably assume that we probably missed a couple cases from before.
Let me just, for clarity's sake, you're saying that we could have gotten it directly from China hitherto, not recognized as this, because we have done direct trade. We did, a medical team came down, and but we didn't see it as that, and there was no medical crisis. But it's when it went Europe to bounce back at us through, no doubt, the United Kingdom, that we start taking notice. And
that's right.
Yeah, go ahead. Just on my
So we have to recognize that as Jamaica's reach for independence and development, and from 1972 to the initiative of recognizing One China, a product of that is that we would have increasing direct links with China at all levels in society. And we have to recognize that China controls all our major seaports in Jamaica. They've been bought by the Chinese. And in terms of bauxite, we know the Chinese are heavily embedded within our bauxite industry, certainly in Manchester and in St. Elizabeth. So ships would have sailed directly from China through the Panama Canal, presumably, into our seaports. And these persons would directly come on our land and interact with with Jamaicans. So we know directly there would have been links from China. And as it spread to Europe, Europe would obviously also spread directly to us. So it is very likely that this virus has been with us significantly before that Sentinel case was identified on a British Airway plane from London to Jamaica. I mean, there are 5 flights Monday to Friday from London directly to Jamaica. And of course, you can go indirectly to the United States any day of the week from Jamaica to London. But recognize that this virus would have probably come to us before that Sentinel case was identified in February, was it March last year? And I think
I get the sense that you're building up this to say something a little
yeah.
important. You're building
Okay.
this case.
Let us
What is it?
understand. Let us understand the context that, and I want to emphasize the term hysteria at this point. Hysteria is not a simple matter. It's a grave thing that has to be managed. If you look on what's happening in another country and not properly interpret the context, and you're missing a very important point. When you see people dying on the streets and people in ICUs overflowing and the morgues overflowing, it's a natural nature of things that you think, wow, this thing is so dangerous that, boy, if it ever comes here, it's going to kill us all. But what we didn't recognize properly is certain attributes of this known coronavirus. Once we knew that this was due to the coronavirus or attributed to the coronavirus, then it automatically told us something very fundamental. It told us that this, in fact, was a winter virus. It's a very important point to understand. It's a winter virus. Winter viruses are extremely fierce. They are active when the temperature is cold or cool, certainly below 26 degrees Celsius. And I want to use 26 degrees Celsius as a important point of reference, because what we know, and this is never disputed, every study that relates to this virus, at 26 or 27 degrees Celsius or higher, the coronavirus dies within a few minutes of that temperature. And our humidity further makes it difficult for the virus to pass from one person to the next through droplets or the respiratory part, because the humidity is so much that the viruses literally fall to the ground. And so the distance between people doesn't have to be, would have to be closer compared to places that are less humid. So the coronavirus is a known winter virus. We had coronavirus year 2000, coronavirus 2010. I got coronavirus in 2003 when I was living and working in England and training at the time, specializing. And the minute I came to Jamaica, within a day, less than that, I felt better. I was coughing for a few months at 4 degrees Celsius. And the minute you come to this heat, 30 degrees Celsius in December, amidst of winter, I stopped coughing. And that's the nature of these viruses. We get them as a part of the winter tourist season. The winter tourist season, and Jamaica's tourism product is very strong. The winter tourist season brings with us every year, bar none, winter viruses. They come from our friendly neighbors in the north who are trying to seek refuge from the cold. They also come from our loved ones. We should not see this as, wow, as a danger. We should welcome them, because the warmth is the single most important factor. The temperature is the single most important determinant of how fierce this virus is. So when it's hot, the virus becomes very weak, and its spread and its toll becomes very, very minimal. When it's cold, the virus becomes very strong. So the coronavirus is known. It's known. It's a known winter virus. We must recognize that. And though we see these deaths on the streets in China, Wuhan, or in Ecuador, you must recognize that the temperatures in those places are different to the temperature year-round in Jamaica. Jamaica's average year-round temperature is 33 degrees Celsius. We have to recognize this, because in recognizing this, this will shape our policy and approaches. We cannot be just copying policy, copy and paste policies that are applied in northern climates when it's cold and simply bring it down into our practice here in Jamaica. When the northern climates become warm and hot, they certainly become hotter than us in the summer. You see a marked reduction in coronavirus cases and coronavirus deaths, more so than cases, but coronavirus deaths when the temperature becomes warm. And we're seeing the exact same thing happen now in South America, in South Africa, in Brazil, because the southern hemisphere had just come out of their winter and are now going into spring and are about to approach their summer. So we'll see their numbers literally falling, whereas in northern hemisphere, the numbers rising. So it's like a boomerang effect that this virus started in the northern hemisphere when it was cold. And so the numbers rose, but as the temperatures warmed up towards the summer, the numbers fell. And then Brazil, which was very positive in terms of, perhaps too positive in terms of the impact the virus would have on them. The minute they entered winter in June, their numbers skyrocketed and they moved from way at the back of the pack to number 2 in the world. And Brazil is still the second largest number of deaths in the world, though their mortality rates definitely are falling. What Brazil needs to prepare for is come next year, June 2022, when the next wave will hit. Hopefully by then, of course, the vaccine would have been implemented in millions of Brazilians, so that when June come 2022, the death toll would not necessarily rise as much as we had just past June. Yeah, so the most important determinant is the winter virus, is the temperature in our surroundings.
Dr. Hunter, you have gone off and you're on record of saying schools should open up, business should open up, free up this thing because we are a virus secure venue, a bio secure venue. Do you think that even with the relative small amount of that, people would be convinced about that? And would it just be opening up like that, or would there be some kind of reality to our opening? Because people do die and people do get sick here.
Michael, it's very important, the question that you just asked. Hysteria is not a simple matter. People have been literally scared out of their wits. When you have doctors closing their practices because they don't want to catch corona, because so many hundreds or thousands of doctors and nurses and therapists have died overseas, it just shows you if doctors can be scared, what of the patients? What about people, lay people? So the hysteria is a huge deal to overcome. I think that though, Jamaicans are slowly overcoming this hysteria and the corona stress. They're slowly doing it because they've been waiting for this surge and it has not come. They've been waiting for this massive, some people predicted even last week Sunday, I see a figure of 60,000 Jamaicans dying from coronavirus. It's clearly, this is not logical. Not logical at all. We're seeing others predicting 17,000, totally illogical. Jamaica is a hot country. We're protected by the heat in terms of how a winter virus would function within the heat. Now, if you are so blessed in Jamaica to be able to keep your ambient temperature at 15 degrees Celsius every minute of the day, in other words, you sleep in the AC, you go to work in the AC, your car is in the AC, you go to the shopping centers which have AC, then you're beginning to create a bit of a cooler environment and literally put yourself at a slightly higher risk of being ill from the coronavirus. But if you notice that those folk who do not have AC as their luxury, that's not their reality, where they go home, where they work, if they work out in the sun, be they farmers, be they construction workers, you will not see this tremendous, you won't see this tremendous death toll or this disease burden by coronavirus in this population. So from February of this year, I've been saying this is a great economic opportunity for Jamaica because we are blessed by having a warm and hot and often humid temperature that literally would inactivate, would literally make the virus very weak and easily overcome by the majority of us in the population. I'm not saying that there are not a few deaths, but these deaths are minuscule, minuscule compared to the disease burden when it's cold, like what's happening now in Europe and North America, and the inverse of what's happening now in Brazil as it moves towards its summer. So we must recognize that our year-round heat and year-round humidity is a direct protector of us, the population, from the ravages of this coronavirus. And we can implement policies such as opening the windows, turning off the AC, avoiding the AC, and going outside. And by that, I mean go into our gardens, go into the park, exercise, get sunshine at least 3 times for the day. This will, by and large, significantly reduce our chances of succumbing to this winter virus.
I'm not hearing about wearing a mask.
I firmly believe that we should have recognized this very early on and in fact, kept our institutions open, kept business going, and actually saved lives from the ravages of coronavirus in North America. Right now, over 1,000 Jamaicans have died, but they have not died in Jamaica. They have died where it is cold, in New York, in London, in Toronto, in Atlanta. That's where Jamaicans have died from this coronavirus because they were exposed in a cold environment. And my heart goes out to them now because the winter is not even here yet. Yet, it's so cold already. And if this winter lasts so long, then you're going to find more Jamaicans dying in New York, in North America, in the United States, wherever it is cold. And we have a duty, a moral duty, I would say, to allow us Jamaicans to come home, allow foreigners to come home, and to benefit from the healing effect of the sun, the therapeutic effect, not the relaxing effect. We're talking about the therapeutic effect of sunshine in killing this virus, in reducing the lethality, in reducing the degree to which this coronavirus can ever make us sick.
I want to drill down on some specifics here. Come out of the sports bubble, open the schools, open Jamaica for business, sell it as a virus secure venue. That would be your sales stage.
That was from February last year. I've been saying it from the minute we knew this was a coronavirus. It told us that we are not going to be ravaged by this virus. It is a winter virus. It dies at below 20, it dies above 26 degrees Celsius. We know that. That's not disputed. Every study shows that. We need to implement policies that recognize this and to best enable us as Jamaicans to empower ourselves. We need to go outside into the sunshine. We should not stay inside. We should not stay inside.
What about
Whereas in North America, they can stay. Pardon?
What about masks? The wearing of masks. What do we do now as we reopen? If we were to say, let's go for Dr. Hunter, guide us through this. How would we look? Would we cast aside all that we have been doing, washing hands? Give me a sense of wanting to err on the side of caution.
Okay, there's no doubt. I mean, I've watched my country err on the side of caution for the past 10 months, and I get it. There was an election to be won. There was an election in the air. So that had to be managed. I get that. I understand that. And it was managed up until August, September in a certain manner, that every day on the news. I get that. But let us know let us recognize another fact of the coronavirus. It's very, very tiny. This is not in dispute. It is extremely tiny. The coronavirus is about 0.125 micrometers. That's very, very tiny. It's a very tiny virus. If you ask a farmer, well, and I have done. My father himself being from the farming background, can you stop a plant virus? They said, Doc, no, no, Doc, you can't. You have to burn out everything to try and stop a tiny respiratory virus with a mask. You're not going to be 100% successful. I wouldn't even think you're going to be 50% successful. If you should look at countries, let's do a simple observational study. Take the Czech Republic, which was absolutely draconian in locking down and enforcing the wearing of masks, and compare to the libertarian America, where it was up to your individual liberty to wear a mask. Some did, some don't. Those who did tend to be Democratic. Those who didn't tend to be Republican. Unfortunately, the whole wearing of masks got caught up in the political discourse. And again, that's what elections do. But when you compare America and Europe, Europe, which was seen as vastly responsible, as a very mature society, developed societies where order and discipline is, and people are very much oriented towards science. When you look at them and compare them with United States of America, Michael, you're looking at the identical results. That those who wear masks and those who did not wear masks essentially end up in the same boat. They're in the same boat, that the coronavirus is ravaging those societies now as we speak. Thousands of cases per day, in tens of thousands of cases per day, if not 200,000 in North America. And in Europe, if we say Europe is a country, take the entire Europe as a single country, they are the number one in the world. They have more corona deaths than any other individual entity in the world. They have more corona cases than anywhere else in the world. So masks have severe limitations in ever being effective in stopping coronavirus. But when you look at masks in terms of stopping other respiratory-borne illnesses, other bacterial illnesses, they definitely play a role. A bacteria is much larger than a virus. Now, it can definitely help with stopping some some fecal oral diseases. It can help you in reducing a lot of other respiratory illnesses. So it's not particularly coronavirus that I'm necessarily looking at. I'm looking at other illnesses. But by and large, it's very, very limited. To the specific point regarding coronavirus, every study will clearly point out that the virus, the masks have been very limited in their ability to stop this wave of coronavirus that's equally affecting, if not more affecting Europe than North America. And it's unfortunate when the virus is put into the political field and you champion yourself as trying to stop this virus when you didn't cause this virus. You cannot control the ambient temperature. No first world country can all of a sudden turn on a switch and their outside temperature becomes 26, 28, 30 degrees Celsius. No developed country in the world can do that. The technology is simply not there. So to the point of the masks, again, there is very, very limited instability. So us in Jamaica implementing masks, I think we need to be a little bit more tempered. And I didn't appreciate our limited stretched police resources being used to chase people down in town centers, in Halfway Tree, in Maypen in particular, who weren't wearing masks, when in fact crime and violence is a much greater public health problem in Jamaica than coronavirus. And so to the point, the masks in Jamaica are very, very limited in terms of coronavirus and trying to stop this respiratory virus. A simpler method is turning off the ACs, open the windows, and going out several times a day, probably 3 times a day for 15 minutes to get some sunshine.
Might I ask this in light of one of the strategies you would use, welcoming people here as a biosecure venue? What of many of us who we like to travel to foreign, North America in particular, this season? Would you advise that? Would you say stay put?
This is where I temper what I am saying. What type of virus it is? It's a winter virus. Because it's a winter virus, I will do whatever I can to minimize the advantage that the virus has in the cold. So, for instance, as we travel to North America to share in Thanksgiving or Christmas later on New Year's, and what I would certainly do and encourage people to do is to turn up the heating inside their houses, turning up, put it as high as 28, 20, anything above 27 degrees Celsius, because at that temperature, the virus will die. We know you can't necessarily change the ambient temperature outside in the streets, although I know in Paris they heat the streets, but that was a big issue with respect to climate change and greenhouse emissions. But what you can control is your indoor temperature. And so indoor temperatures need to be higher in those countries. You need to turn up the heating. But the reality is that not many people, let me rephrase that, a lot of people have to make the stark choice in those countries between heating and food, that the heating bill is just as bad, if not higher, than an electric or JPS bill, for instance, to single out JPS, but it's higher than an electricity bill. So the heating bill is something that we never know about in Jamaica. But in those countries, a heating bill is extremely high. It costs a lot of money to heat a house, to heat an office. And very often, from my experience, the temperature is just set at about 24 degrees Celsius. Now, that's the average temperature of Mexico City. If you set the temperature at 24 degrees Celsius, then that's not going to kill the virus. You have to set the temperature at 26, 27 degrees Celsius or higher. Now, that is going to increase your heating bill tremendously. And so if I were policy framers in northern countries, I would see what relief could be given to the population in terms of their heating bill, perhaps offering to do a 50% discount on the heating bill to encourage people to keep warm, to keep hot, because that is far more effective at killing the coronavirus than wearing a mask or necessarily social distancing within households. Yes. On the outside, it's a different matter. We saw that, for instance, the Democrats use a lot of conversations around wearing masks and social distancing. But what was quite interesting on the weekend, when Joe Biden was finally declared a winner, we saw parties amongst Democrats, and there was no social distancing. So, was that a super spreader event? I'm not sure. I'm not political either way in America, but I just saw I couldn't help but notice the paradox, the contradiction that existed. But I would just simply stick with the basic thing. Turn the temperature up, make it hot, and I think the rest will pretty much will sort itself out.
Let me check in with you with some basic facts. During our election recently, we saw where the spikes were. Nomination day, election day, that caused the numbers to move dramatically in terms of spikes. Those who contracted it, those who died. Shouldn't we, based on that, we have holidays are coming up. Shouldn't we still be walking?
I think you need to be a bit more circumspect in assessing that. Well, okay, during the summer months, there was a greater influx of Jamaicans who, from abroad coming here and visitors as well. And, tourism product was reopened in June. And they're doing very well, as a matter of fact. The tourism product is doing extremely well. We're not hearing any visitors dying from coronavirus, though I'm sure by now more than one visitor would have had coronavirus or necessarily even contracted it here. But what you have to also understand was that United States government donated a $2 million kit. Remember, in June and July, the conversation was all about this backlog of tests. So when you suddenly increase your capacity to test, you suddenly increase your awareness. And wow, the numbers. So some of that wasn't just about the political musings and the nomination and election. Some of it was just the ability to test. If we had this machine in December last year, you'd be surprised. Perhaps you'd have seen a few positive results there as well. So I'm not so sure about all this nomination and election and Independence Day activities necessarily. The coronavirus in Jamaica is largely asymptomatic. It's asymptomatic. That majority, 99.99% of people who get coronavirus in Jamaica will never need to seek medical attention because it is so mild. It is such a mild disease. We will get the virus, but the majority, the overwhelming majority, will never die from the virus and will not need to burden an already failing public healthcare system. It would never need to because the natural heat and sunshine would have taken care of that for us. If Jamaica was a cold country, then guess what? Thousands of us would have died. Nomination day or not, Independence Day or not, regardless, that would not necessarily, it would have killed thousands of us. If we look at Ecuador, which is a poor country, Ecuador, which sits on the equator, is not a hot country. Though it's on the equator, it's actually a very cold country. Probably average temperature is about 10 degrees Celsius, going low as 7 degrees Celsius. In Ecuador, thousands of Ecuadorians have died, thousands. If you combine poverty with cold and you introduce coronavirus, you're looking at a situation that's worse than New York. The death rate in Ecuador was worse than in the United States of America, despite them applying masks and social distancing. The fact is, their cold temperature, once it's below 26 degrees Celsius, the coronavirus will kill. Look at Mexico City. Mexico City, which is over 20 million people. The average temperature of Mexico City is 24 degrees Celsius, which means at midday in the blazing sunshine, it's never hot. Mexico City is never hot. So over 100,000 have died in Mexico City. So the number one factor that controls the amount of deaths that occur due to coronavirus at this point is actually the temperature, your ambient, your atmospheric, your surrounding temperature. Are you below 26 degrees Celsius? Are you above 26 degrees Celsius? And not just above 26 degrees Celsius. If you're talking about in your 30s, unimaginable to ever think that New York could ever have temperature as high as 30 degrees Celsius at this time of the year. Impossible, because they're now in winter. They're towards almost in winter. So it's very, very cold. And so the temperature is the number one most important factor. Majority of Jamaicans would catch coronavirus and not know. In terms of sampling and being aware of these surges, I would put it to you that if you're not testing every Jamaican, you absolutely do not know how many Jamaicans really have the virus. So if the Ministry of Health is posting, oh, they tested 1,000 or 10,000, you're really missing, you're completely missing the true extent. You're not sampling enough. There are great limitations of sampling. You have people who get coronavirus, get over it. You then come along and sample them, you test them, and they're negative. But you never knew that they actually got coronavirus a month ago. And we have several high-profile individuals who got coronavirus, and in no time they got better. PNP General Secretary, if he didn't get a positive test in the week of the election, he would never, Charles I would never know that he had coronavirus. The Commissioner of Police, by the time he was told he was positive, this was almost like a month later. And he's obviously back on the job. Coronavirus, which causes a common cold, is not nearly as lethal in hot climates. And this is a reality which is born not only in Jamaica, but throughout the hot Caribbean and throughout Central Africa. So we need to have our own narrative to recognize that the coronavirus will definitely spread amongst us. We'll nearly all get it, but the overwhelming majority will never become ill from it, will not die from it. The tiny, tiny proportionate ratio will actually succumb. But it's quite interesting to see how even the whole business of announcing a death in coronavirus is a bit controversial. Why do we hear, oh, patient under investigation? Why isn't it so clear cut that if you die from coronavirus, it's clearly obvious you can see within a day or two that you've died from coronavirus? Unlike, for instance, say, for instance, a motor vehicle accident or a trauma, or you get stabbed, or, for instance, a heart attack when it's obvious. Well, so there is some question about ascribing a death to coronavirus. It's not as simple. For instance, we know with Bob Wilmer, ascribing a death is not so straightforward. 3 different pathologists came down on 3 different causes of death. In fact, to this day, Bob Wilmer's cause of death is still an open verdict. So cause of death is not that straightforward when it comes on to coronavirus. So I would say that the majority of Jamaicans are really exhibiting signs of hysteria, a huge amount of hysteria when it comes on to coronavirus. It's a common cold virus. It does not do well in the hot tropics. It does not do well in the humidity. It does not do well in the direct UV sunlight. And we need to recognize this. Turn off our ACs, like mine is turned off now. Save a lot on the electricity bill. Go outside, exercise, lose weight, and be positive about it. But something that if you are told that you have coronavirus in Jamaica, it can literally kill you, just being told that you have coronavirus, because of the amount of hysteria that surrounds it. Because what's going to happen? You're going to start feeling unwell. You're going to start, your heart rate is going to go up. Your blood pressure is going to go up. You're going to perhaps forget to take your tablet because you're also concerned about the fact that you got coronavirus. Therefore your diabetes or your high blood pressure is not well controlled. You then literally die from your chronic disease and not recognize that really coronavirus really is not your main issue to worry about. Our main issues of concern in Jamaica is not the 250 or even 500 corona deaths. The number one issue is going to be cancer, stroke, and heart attack, which kills roughly 15,000 Jamaicans every year. That is our public health concern. Not even crime and violence kills as many Jamaicans. So to be developing hysteria around 250 Jamaicans that have died from coronavirus. And there's still a question mark if everyone really died from coronavirus. But let us accept that they did die from coronavirus. That still pales in comparison with motor vehicle accidents, and certainly dwarfed by 1,800 murders, and significantly dwarfed by heart attack, stroke, and cancer, killing 15,000 Jamaicans every year. So I think hysteria needs to be managed. It needs to be carefully removed from the consciousness of Jamaicans so that we can stop making ourselves unwell from simply worrying to death. Yes. We need to go to our doctors to get the blood pressure medication. We need to go to our health centers. We need to control our diabetes. We need to control our high blood pressure. Several patients told me, boy, doc, I have not gone out for 3 months because I'm afraid of going to the doctors because they don't want to get coronavirus. And their blood pressure medication is out for 3 months. Now, I think that we have a huge surge of people dying from heart attack, stroke, and cancer this year in Jamaica. And some of that is contributed to by the fact that people, for one reason or the next, were not able to access conventional treatment or did not access conventional treatment for their high blood pressure, their diabetes, their cholesterol, and subsequently died from cancer, stroke, or heart attack. And there was even a recent study that showed, coming out of France, that a 1-month delay in treatment of cancer, that's during this COVID, results in a significant increase in mortality in patients newly diagnosed with cancer. Many patients have been delayed because of the coronavirus and their perception of the virus. And even on the other end, the healthcare team, in terms of delivering the care, because of these adjustments made to coronavirus, there has been delays in treatments, more than just a few days. For others, it had been months. And that, I would submit, for some people would have proven to be quite devastating.
Doc, you have acknowledged that hysteria in this case is a big thing. And how the brain works is that it likes comfort levels. Yes?
Absolutely.
To take us from this hysteria into a path where we should recognize the sun and the value of the sun, the virus secure zone that we have called Jamaica. How do we make that transition now? Because when I post every day 10,000, 200 and odd dead and still increasing, how do we move from people who don't leave home without masks? Because the scientists are telling us uh, here and abroad, because we are not in a cocoon. We listen to those overseas as well, albeit in their cold climes. Uh, what? How do we make that transition to feel secure when we are, yes, we consume from the world's table of information?
Very important question. I think that, well, for me, I was quite clear in my mind from the very beginning in terms of how this winter virus would behave in a hot tropical country. I think the powers that be, by by that I mean the leaders within our country, within the Ministry of Health, need to communicate openly to the Jamaican population that what has been the experience after the 10 months of watching coronavirus, what has been the result? What has killed more Jamaicans from February to now, letting us be aware of what our true COVID is. What's our true COVID? And it's that block, that 1, 2, 3, the triumvirate of cancer, stroke, and heart attack. Those three, they need to come back into the consciousness of Jamaicans. We need to say, you're several times over, 100 times more likely to die from cancer, from stroke, from a heart attack than from coronavirus. This has been the case for the past 10 months. With that impressed in the minds of Jamaicans, you then begin to shape the strategies around improving outcomes in cancer, improving outcomes from a heart attack or from stroke. So you need to emphasize that we need to exercise. We need to go outside and get sunshine. We need to lose weight. Obesity bar is easily the #1 most important negative outcome factor compared to all others. Obesity in North America, in Europe, wherever you have coronavirus, if you are obese and contract coronavirus, you're more likely to have a negative outcome if you're in a cold space. In Jamaica, we know obesity would, from the Ministry of Health figures, it seems also that obesity of those 200 that are 250, that those patients who are obese seem also to be struggling more with coronavirus. And therefore, the whole business of obesity has long been recognized across administrations in Jamaica as a big factor in terms of reducing the lifespan of Jamaicans. This fits in already with the whole Get Moving or Jamaica Moves campaign. We need to get back on track with the Jamaica Moves campaign to tell people to get moving, to lose weight, to look at what we're eating, to look at the food security. Right now in supermarkets, 90% of what's on the shelf is imported. How do we know that the preservatives are all safe? How do we know? Should we be emphasizing more consumption or greater consumption of local produce, which are free from preservatives? We need to shape this dialogue so that Jamaicans can understand the thing that's killing us is not coronavirus. It's the cancer, it's a stroke, it's a heart attack. These things win down, hands down. And the things that make these worse, high blood pressure that's not controlled, diabetes that's not controlled, obesity driving all of these two factors, high cholesterol driving all these two factors. Stress is an important point. Stress is not necessarily an entity that you can measure and get an objective figure, but stress, the constant worrying, whether it be from corona or inability to make ends meet. With this coronavirus, there's a huge economic toll that's stressing the population. Workers have been laid off. Over 200,000 people have lost their job. record, never in Jamaica's history have we had over 200,000 people losing their job and an administration is able to win an election with a landslide. If we were saying, how is it possible? Stress is a huge factor that needs to be looked at. We need to employ more psychological services, more psychiatric services, more counseling services, more guidance counseling services, more social work. Every school in Jamaica should have a social worker embedded in the school because we know parents have lost their job. If not one or two parents have lost their job, they can't pay their mortgage. They can't pay their rent. They're about to be evicted. That's real stress. People's lives are in danger. We need to say that the coronavirus is not a devastating disease in Jamaica. Far from it. 99.99% of Jamaicans will catch coronavirus and never know they have it unless they've been given a positive test. But what we know, if you have a heart attack, you're going to know about it. Unfortunately, for some people, when they get a heart attack, by the time they know about it, it's too late, they're dead. Or a stroke, it kills instantly. If you get cancer, that's going to kill you, you eventually will know about it. So we need to recognize that coronavirus is by and large asymptomatic within our hot climate. And to get people moving, to lose weight and attack the main public health burdens in Jamaica. But also look at crime and violence. Coronavirus has also made it more difficult for the security forces. When you wear a mask, it's very hard to properly recognize someone's facial features. And so that's caused a huge challenge. The criminals within our midst, the gunmen, have long recognized that coronavirus is not impacting their way of life. It's not reduced the murder rate anyhow. It's not made it more difficult for a gunman to go and shoot someone. That was readily recognized after a week of announcing the first case in Jamaica. Our crime rate has not decreased in any significant, any mentionable amount. So we need to recognize that we need to tackle the big three and number 4, crime and violence. We need to recognize what the corona impact has had on the economic prospects of Jamaica and how it has potentially fueled crime and violence by putting more people into poverty.
And I want to thank you very much for your time.
Can I just say, perhaps this, I thank you again for this opportunity, but I, for one, recognize the importance of vaccine and vaccinations. I think all vaccines need to be carefully examined and looked at properly, but I'm not against vaccines. But the reality is that in Jamaica, with such a minuscule impact that coronavirus has had in terms of death, we cannot justify a massive rollout of vaccines across Jamaica because it's simply not cost effective regarding coronavirus. Vaccines are absolutely crucial for poliomyelitis prevention, for measles, mumps, rubella, absolutely crucial. But when you talk about a disease such as coronavirus, which itself needs other conditions before, whether it be obesity, cancer, it really brings into question whether or not our tax dollars should be pumped into vaccines, which at least half of Jamaica will not be embracing for sure. And we need to recognize what's happened with the influenza vaccine as well, where the majority of the influenza stock of vaccine is dumped year after year. Over 35,000 vials of influenza vaccine has to be dumped because it's not taken up. So we have to be very careful how we spend this precious dollar to affect the health and well-being of Jamaicans. So we need to get back on track and recognize the killers of Jamaica, the cancer, the stroke, the heart attack, and then the stress that's driving this, the stress that's driving the crime and violence, the stress that's driving the motor vehicle accidents, and see how we can implement policies to mitigate that and to save the lives. We have a moral duty to save the lives of those who are trapped in winter countries. One day, Jamaica may need the rest of the world to bail us out. It's just a matter of time before a massive earthquake hits Jamaica. And we certainly going to need the international community to help us out. When, if for instance, a tsunami should just come right through the entire Kingston, eradicating nearly half of Jamaica's population, we have a moral duty to say to the world that we are hot. Our figures clearly suggest that the heat is not conducive with coronavirus, and we think it is better if you can come into a hot space for a few weeks or a few months to build up your vitamin D levels, build up your immunity, and then return. I think that Jamaica will end up saving the world and helping a lot of people in the world.
Again, thank you very much, and all the best to you as we look forward to greater days. Thank you so much.
Thank you.
Bye-bye.